The floodwaters are gone, but what's left behind is a potential public health hazard, the spread of the Zika virus.
Late this afternoon, a warning from public health experts about standing water left on your property or even in near carpets or in your furniture. This can be breeding ground for mosquitoes, which can transmit the virus. They have big concerns about the risk, especially to women who are pregnant.
And as we learn more about this virus, there's word today of promising new research in the fight against it. Medical reporter Liz Bonus joins us now with the story and the latest on protection in pregnancy. Liz.
Good evening once again. For the first time, we are hearing that there may soon be drugs on the market to actually reduce some of the damage to the body by the Zika virus. Scientists have learned that 3 existing drugs could help counteract the effects of Zika. Now, experiments have only been done in the laboratory so far, but it appears these drugs are so effective they may even reverse some of the damage thought permanent. The drugs are currently used to treat cancer, hepatitis C, and parasitic infections. They must be tested on animals before they can be tested in humans. So right now it is unclear if the drugs can penetrate a woman's body to treat the brain of her unborn baby impacted by Zika. That brain impact, of course, from Zika, raising worries for moms already expecting as mosquito season and this virus continues to spread. So today we asked the experts at TriHealth what can be done to protect an unborn child against Zika. It's a new concern for many new moms, such as Brandy, expecting a baby girl in just a couple of weeks.
Slightly, mildly. There's a lot of talk about it.
That talk now growing in women's health visits across the country. This virus, transmitted by mosquito, is now popping up in more areas around the country. Dr. Regina Whitfield Kekessi says it does have symptoms,
including fever or rash or joint muscle aches.
And because those symptoms may mimic other illnesses during pregnancy, she is encouraging women to ask a few questions, or more importantly, to answer a few with your OB/GYN. Have you traveled to Zika-infected areas? Has anyone in your family traveled to those areas? And have you been protecting against some of the things that could transmit this virus? Dr. Whitfield Kekessi says pregnant women who want to reduce risk can not only avoid travel to Zika-infected areas, but also use insect repellent with DEET, now considered safe for use in pregnancy.
Or you can visit the cdc.gov website for more detailed information about what products are safe in pregnancy to use.
While Brandy has avoided risk and is expecting a healthy baby girl, for anyone with concerns due to travel related to Zika,
we do evaluate the baby via ultrasound to assess the growth of baby, and we evaluate that baby every 3 to 4 weeks until baby's delivered.
Now, also in Zika today, we heard from experts at Hawksworth Blood Center. They are talking about the latest efforts to stop the virus in our blood supply. Specialists say every donor now will soon be asked to consent to have the blood they donate tested for Zika. Now, this is a new requirement by the FDA. If anyone does test positive, they will be confidentially notified. Hawksworth has already been deferring anyone that traveled to Zika-affected areas.